Hi, I'm Jane Smith, and you may know me from such films such as The Downside of Drugs and The Drugs Can Kill You. But today, I'll be telling you a story about Jim Stanford and how such a successful young man lost everything due to his addiction to oxycodone. Jim was a successful guy, beloved by all his friends and family. Just graduated college and on his way to become a broker on Wall Street. However, after graduation, Jim was involved in a car accident. His accident caused a broken leg and a broken arm and multiple fractures, leaving Jim in excruciating pain. His doctor decided to prescribe a type of opioid known as oxycodone as a pain reliever. Seeing that Jim came from a good family and didn't have a history of drug abuse, the doctor thought it would be alright. Now, how does this type of opioid painkiller work? Well, this type of pain reliever has direct effect on the central nervous system. Oxycodone basically changes the message of pain before it hits the brain and therefore altering the central nervous system ability to perceive pain as well as emotional responses. However, Jim didn't heed the doctor's warnings on the excessive use of the opioid, and soon his tolerance toward the drug continued to build, and eventually he became addicted. So you must be wondering, how can one small pain reliever destroy someone's life and in today's society be so well circulated? Well, this is where the problem lies. Behind its therapeutical effect, there are large groups of individuals that start abusing the drug long term. Therefore, opioids like oxycodone cannot be used as a long-term treatment for people with chronic pain. Let's have a look at the opioid epidemic. In 2010, 12 million people in the United States reported using prescription painkillers for non-medical use. World Health Organization estimated that 69,000 people worldwide die annually from opioids overdose and 50 million people suffer from opioid addiction. As the addiction started to take hold of poor Jim, short-term and long-term side effects started to take place and slowly begin to destroy Jim's life. He began to experience multitude amounts of side effects. Here are some to name a few: vomiting, seizures, fatigue, and dizziness. Jim, however, is now trying to turn his life around after being diagnosed with liver failure due to excessive and abusive use of oxycodone. Jim decided to get help. He is currently in rehab, surrounded by a great support system with a loving family waiting for him when he is ready. After this incident with Jim, we must now ask ourselves, should opioids be first-line drugs for pain management, or are there alternatives? An addictive opioid like oxycodone is an effective pain reliever, especially for those in excruciating pain. However, should it be a first-line drug? No, it shouldn't, due to its ability to being highly addictive. Before prescribing oxycodone, other alternatives should be exhausted and oxycodone should be a last resort. Studies suggest that the better alternative treatment where drug addiction and its side effects can be avoided is multimodal approach, which involves mix of physical therapy, changes in behavior, medications, strategies to accept pain and cope with it. So, even with opioids being under such strict guidelines, why is it that people can so easily obtain it? What surprises most of us is how easy it is to get your hands on it. Oxycodone is sold on the black market or on the streets. It is obtained legally but then sold illegally without a prescription or a seller's license. People can prepare well-rehearsed performances to give to doctors to obtain a prescription. All you need to do is remember the symptoms that would trigger the doctor to logically believe that you would need treatment for extreme pain. How can we make sure not another bright individual gets deterred from their pathway through the use of opioids? There are some strategies that can be adopted to ensure its safe use, like education, which is the purpose of this video. By educating you, the youth of our country, I can give you a better understanding of oxycodone as a drug. Another important improvement that can be made is real-time reporting of a patient's prescription history. This will prevent people going to various doctors to get multiple prescriptions. The doctor will be able to see the last time they obtained a prescription, catching out those that are abusing the system. Doctors can also be trained to recognize drug-seeking behaviors to reduce the unnecessary prescription of oxycodone, ensuring its safe use. That's all we have for today, guys. Oxycodone is a pain reliever, but always be informed by your doctor and do your own research. Always understand the risks. Thanks for watching.